So here I'm handing out now is a drug conversion chart. You need to commit these to memory. Looks like this. But let me tell you how easy this is. All right, let me give you a few pointers here. I'm going to start at the bottom. And if you look at 1 ounce, everybody can identify with an ounce, pretty much, right? 1 ounce of something. Well, that equals 30 milliliters or cc's. Okay, the cc, cubic centimeter, is the same as a milliliter. 1 ounce. So you get medicine cups that are very common. They got 30 ounces in them. It's like a dose of cough syrup or a dose of Pepto-Bismol is usually 30 ounces, or a teaspoon, tablespoon, things like that. And you can take it easy and you throw the cup away. And they're clear, they're marked like 15 ounces, 30 ounces, things like that. Think of your normal glass that you go get out of the cabinet to have a glass of water at dinner. Just a cup. Okay, it's 8 ounces. And everybody's heard the old adage, you should drink 8 ounces of water a day. You can say you've heard that or identify with that before. So 30 times 8, or 3 times 8, is 240 mLs. And that's one cup. So 1 dinner glass cup. Not a cup, not a measuring cup like a cup of sugar, but a cup that you would drink out of cup. All right, and it's important because when you're asking a patient, well, how much water have you drank today? They're like, I had a glass of orange juice at dinner or at lunch or breakfast, and I had a beer at lunch or something. You can kind of equivalent that to 2 cups or 480 ounces or mLs.
If they're drinking beer and orange juice, that's not water.
Well, it gets really important when you're talking to patients with congestive heart failure and edema and they're on fluid restrictions. You're going to help them understand how much they're drinking. For example, I could tell a patient you get 1,000 mLs fluid restriction a day. Well, let's just say they do drink a glass of orange juice and a glass of water at breakfast, and I'm going to say it's the smaller glasses. So that's 120 each. So 120 of OJ and 120 of water. That's 240. That leaves me what? 860? Nope, 760 left for the day.
Okay, I'm sorry, I'm really confused. The 1,000 is how much fluid?
They're allowed to have in the day.
Okay, you said they're drinking the smaller glasses of orange juice.
Yeah.
So it'd be like
Sorry. 120.
Yeah, I did half of an 8 ounce. I said a little smaller glass.
2 4-ounce glasses.
Yeah.
Okay.
I'm sorry, I'm going a little fast, but just stick with me.
Okay.
So they're just say they had that for breakfast alone, right? Now they've got 760 for the rest of the day. So say they have a Pepsi for lunch. How much is in that bottle?
16.9 fluid ounces.
No, I'm looking for
So
mLs.
500 milliliters.
500?
Yeah.
Okay, so I'm at 760 minus 500. That means I got 260 left for the whole day. And you saw how 260 was. So they get to it fast. This is not counting things that are also counted as fluid, like ice cream is counted as a cup of fluid. Jello, chicken broth, any type of fluid. Ice cream is mostly water.
Yeah.
Popsicles, sherbet, stuff like that people eat. So patients have a hard time realizing how critical it is for their fluid balance, first of all, and 2, how hard it is to maintain it. All right? And that's why it's important to know these measurements. The other ones are kind of obvious. You're going to give somebody 3 tablespoons of cough syrup, but you don't have an actual tablespoon in your hand. You've got a measuring cup with 30 ounces on it. You need to know how many mLs are in an ounce. 30. Okay? And I've tried to put this image in your mind of these clear souffle cups that's got like measurements on them. They're very, very common. They come in packs of thousands, and you'll just take them off the cart and put drugs in them all day for patients. All right. So, with that in your mind, in your mind's eye, that picture, I want you to think about a tablespoon. Okay. So that's 1 tablespoon. Well, that equals 15 mLs, or half an ounce. Usually you don't see measurements for medicine in half ounces. And then a teaspoon. I'll draw a smaller spoon to signify that. And it's lowercase, right? It's 5 mLs. So 3 teaspoons are in 1 tablespoon. Easy enough, right? Now, micrograms and liters are a little bit different. Just making sure it's still recording here. So I try to do this another type of visual representation for milliliters and liters, okay? Everybody knows what a liter is because you can think of a 2-liter bottle of Pepsi, right? And a liter is usually you need a liter of water, like usually the big bottle of Dasani is a liter of water. Most of the bags that you hang up for IV fluids might be a liter. Okay, a liter is a common standard measurement. Unfortunately not in the USA. We should be in the metric system. But if you think of a liter as cube, okay, a liter is a measurement of fluid. Well, a milliliter, there are 1,000 of those in a liter. Oops. Okay, so 1,000 of these little tiny cubes would fit in a liter.
1,000 milliliters.
Yeah. Yeah, and milli means 1,000. That prefix milli. And centi means 100. You know, things like that. In fact, this is a blast from the past for a lot of people. Okay, same goes for kilogram. I could just take that out and put K for kilogram, right? Well, how many grams are in a kilogram? Or how many milligrams are in a kilogram? Okay, well, let's look here. Kilogram, I got gram, and then I've got a smaller unit here called milligrams. And what does milli mean?
1,000.
And look on there and tell me how many milligrams are in 1 gram. It's the second one down from the top.
Oh, 1,000.
Okay, so there is 1,000 of these in a gram. How many grams are in a kilogram? It's the third one down.
Oh, 1,000.
Okay, so there's 1,000 of these in a kilogram. Think of the blocks. Units, you know, sometimes it helps people to have a visual representation of these numbers. And in my head, that's how I do it a lot of times. So how many milligrams are in a kilogram? How would you get that number? Just looking up here. I would multiply 1,000, probably times 1,000, right? Do you agree with that?
Math is not my strong suit, especially on this stuff.
Well, it's not going to get much more difficult than this. That's actually 1 million. Okay, so there's 1 million milligrams in a kilogram. But we're not ever going to write 1 million milligrams. Give a patient 1 million milligrams of whatever medicine. We're not going to say that. We're going to say give them 1 kilogram. Okay? Or give them 0.01 grams.
I've never seen medicine wrote down in grams.
Oh, you will. All your pills are in milligrams. Every pill you get is most likely in milligrams.
Because if you read the medicine bottle, it's like so many tablets are in there, and then you just get the tablet, take it.
Well, what are you taking? You just saw Lipitor is 10 or 20 milligrams, the dosage, right?
Mm-hmm.
Motrin, Advil is usually 200 milligrams. You could take 2 to 4 every 6 hours or whatever. 400 or 800 milligrams. I guess start thinking about dosage. How much are you putting in and so on, or yourself? Let's look at the bottom here to kind of follow along on this. So if you're going from a unit of smaller to larger, for example, milligrams to grams, move your decimal point 3 spaces to the left. Three spaces to the left. Okay, so 650, let me put it up here. 650 milligrams. Right here's my decimal point, right? 1, 2, 3. That's 0.650 grams. That's as far as you'll need to go for conversions in terms of these large numbers to small numbers. And you probably won't even see a problem like this on your accreditation test. You'll see some questions like this in my class, but not too many of them, and it's not going to go any further than that. Okay? Now I don't have a syringe in here with me, but if you look at a 3 ml syringe, that's the same as 3 cc's, right? I'm coming back to this now. I'm thinking about 1 ml equals 1 cc. Now we're talking about injection numbers, usually. Okay? The thing that you should leave my class with and enter the field is if you're drawing up a dose to give someone, or you're telling a patient to take this much, and some red flag goes off in the back of your mind somewhere and says, I don't know if I should be telling them to take 1,000 units of insulin. Maybe it's 10 units of insulin. I want you to hear those red flags and go confirm. Okay? That's what I want you to know and to leave here with, is that skill of, maybe I already double checked this. Maybe this isn't right. Maybe I should have someone else look at this. And keep patients from being injured. Right? Horror story, in clinicals, they were talking about, like, nursing students weren't allowed to give insulin because this one nursing student was like working, and she's a student, but she's doing her nursing clinicals. And this old lady rolls up after dinner and says, I'm ready to take my insulin and go to bed. And then she was like, okay, how much insulin do you get? I don't know, I think 10. And so she draws up, like, I don't know, some crazy number and injects it with her. And then they're like trying to keep her out of a coma and from dying for the next couple hours, putting, sugar in her mouth and stuff like that. Well, that's far-fetched, okay? But I don't want anybody to make a mistake like that when they've been in my class. Okay?
Yeah, I almost killed a kitten because I gave her too much water medicine. So,
Okay.
I
So you've been there. You've learned your lesson. Now you're good to go. Now the kitten's just blind and has liver failure. Okay. Let me go a little bit further on some of these measurements. I'm not going to give you any IV drop questions. IV drip rates are way outside your scope of practice. And if you come across one, just ignore it or say, Justin, this was on a test or a quiz, and they don't need to be on there. But I think I've gotten them all out. But you do need to know that this is the abbreviation for a drop, GTTS. Okay? What kind of medicine might you administer that's administered in drops?
Morphine.
No, That's probably going to be going in IV.
What kind of medicine with drops?
Yeah, what kind of medicine do you put on your own eye drops?
Drop. Okay,
Ear
I was
drops.
thinking of the wrong.
Yeah, I know what you mean.
Yeah. Okay. So if you see something that says give 3 OU Q4 hours, that means both eyes, Q4 hours, 3 drops, right? See how it's all coming together for you now? And you will see that because patients will go have glaucoma surgery and then they'll be taking these drops for like 6 weeks and then they'll go down to 2 drops and they got to taper off of these steroidal eye drops. It's a huge pain in the butt and you're having to constantly tell them and write it out and show them because it's hard to get it all together. Okay?
Especially after we had to do the drops in Carl's eyes because he had that surgery where he fixed his nearsighted or farsightedness.
Mm-hmm.
And we had to do eye drops like
Yeah, so you both know very well what I'm talking about and why it's important. You're on the other end of it now. So those top ones, I would make sure, I would know all of those for no joke. 1,000 micrograms to 5 mLs. I would know those top measurements and then, well, I would know all of these. Let me tell you about drops though. You should be able to easily identify that there's in 1 ml, which is where everybody should be starting. Everybody should know what that is. Same as a cubic centimeter. It's 1,000 of them in a liter. Okay. There are 15 drops in 1 ml. There are 15 mLs in 1 tablespoon. Okay, so tell me how many drops are in a tablespoon, Melissa?
how many drops were in a tablespoon?
Mm-hmm.
1 milliliter.
Huh? Let me make it easier for you. How many drops are in a teaspoon? There's 5 mLs in a teaspoon. So 15 drops in 1 ml. And there's 5 mLs in a teaspoon. What's 15 times 5? Well, 15 times 2 is 30, plus another 30 is 60.
75.
Yep. 75 drops in a teaspoon. Okay. You might see problems where you need to convert drops to mLs. It'll be kind of tricky. I'll show you where all the pitfalls are at. Don't sweat it.
Well, I have a question. Okay, so back to the 15 drops in 1 milliliter.
Uh-huh.
And then you want to find out if there's 15 milliliters in 1 tablespoon, how many drops would that be?
15 times 15.
Okay, yeah, that's what I was thinking. Yeah,
Mhm.
okay. Okay.
Or 3 mLs, or 15 mLs, I'm sorry, 15
Okay.
mLs.
Okay,
3 teaspoons in a tablespoon.
I got it. I just want to make sure.
Right? So just to kind of get you feet in the water here.